Right, well, the UK is fat-stricken. SOS, Mayday, Mayday. Nothing so far is working to help Brits get out of the fat ditch we are stuck in. Nearly a quarter of children leave primary school obese. Yet we are still treading softly, softly around this topic. British lives are worth more than this. Our lack of intervention on this issue will end up lowering life expectancy to what it was in the Victorian times. What a shameful legacy to leave for future generations. Could copying Japan's hostile climate to obesity be the answer? Well, only 4 to 5% of adults in Japan are obese, compared to 29% in the UK. And it's not all about diet. Companies are responsible there for measuring waistlines of their workforce. And if employees exceed it, it can lead to consequences at work, like 10,000 steps a day. And they also reward employees with an Amazon gift card for doing 8,000 steps a day. The government broadcasts an exercise class every morning. It's the law that workers across the country pause to work out together. Just stretches and movement classes, nothing rigorous, but it gets their blood pumping and sets them up for the day. They also have this weight loss app that combines virtual romance with how much weight you lose, with your love interest character hurling insults at you until you get the dial moving. Harsh, unpopular measures, I'm sure, but is it worth a try? It could start to lift millions out of poor health, become more productive, healthier and happier, and this would filter down to the children. Like it or loathe it, this is saving lives. Are we brave enough to follow suit? Nana, £6.5 billion of taxpayers' money is wasted every year on obesity-related illnesses. Are we intervening too less? Should the state get involved?
See, I don't like the idea of state getting involved in people's health
Unless they're killing them.
Because in people's healthcare, well, no, for a good reason if they've done something bad, but for people's healthcare, when it comes to actually obesity, I believe that you have your own self-control. And if you don't act, you don't use your own self-control, then what is this? Nobody's forcing the food down their mouths. People are eating too much and getting fat. And the reason why I wasn't a very good trainer is because I was like that app, and people didn't really like it in this country. I think we'd have a load of lefties going, oh, you call me fat, and they'd be suing people left, right and centre. This could never happen in this country, sadly.
That app that you mentioned, was it a state-owned app?
No, it's not a state-owned, but it's very, very, very popular. And the more weight you lose, your virtual love interest, keeps calling you fatty and tubby and hurls abuse until you lose your weight, and then you get together with the love interest.
I'm not sure you'd say that's coercive control or something.
I'm not sure about the whole virtual love interest thing, because we know that in Japan they've got a real problem with, just love interest in general. Yeah. People aren't having babies, people aren't in relationships. True. So I think that whole virtual love interest thing is a bit weird. Why don't partners actually just take a more active role in saying, oh, darling, you've been eating too many rolls. No. Maybe you should get on a treadmill.
Do you think we're too sensitive about fat in this country in terms of, if, for example, at school and work, if it was mandatory to do 45 minutes every morning before classes or work starts to get them out,
Belinda,
it wouldn't work because we'd have the whole thing, it's freedom of choice. We can't be forced to do anything. It'd be all of that.
They can pay their own medical.
Do you know what? It could be part of this national service that I was suggesting. That people do their exercise. Look, I'm very authoritarian when it comes to health. I think people should be doing their exercise. I think what Japan is doing is wonderful. Yeah. We're too fat in this country. Let's all get on a treadmill and lose some weight.
I mean, look, so if I get this app, I will get a love interest. Might be virtual, but that would be a great improvement on the current situation.
But it'd be hurling abuse at you, Benjamin.
Yeah, it'd be going, hey, Francie, get up.
So long as, that's why I do this show as well.
Perfect.
Look, do you know, the thing is, I think this idea that you can shame people into losing weight when they're seriously overweight is just wrong. People, they're overweight, they're not blind, they know what they look like. In the one sense, they don't need you to sort of steady foot around them, but I think that they need support, because often it's mental health issues, it's depression. If they didn't start with that, they often have that when they, become very large. I think you have to help people with carrot and stick, not just tell them.
But that's what it is. That is carrot and stick. That is carrot and stick.
That has not worked so far. There's been carrot and stick for decades in this country.
And they've been eating all the carrots.
There hasn't been enough carrots.
And it's not working because, let's be honest, it's really hard to lose weight. I feel really sorry for people who struggle with their weight. I don't think it's all about, them. It's the climate we've created.
But the food is terrible.
But it's not all about food.
It's this blaming other people.
I'm not one to promote Katie Hopkins, but she did this brilliant television show a couple of years ago where basically she put on loads of weight and then she lost it, and she said the way she lost it was by eating less and moving more. It's not rocket science to lose weight. So I really hate it when people say, oh, it's so hard to lose weight. Reduce your calorie intake, increase your exercise,
that's not quite true.
And you'll lose weight.
No, as a trainer, I know that's not quite true. There are hormones, and hormones can control and regulate how... No, they can regulate whether you lose weight or not. So some people will literally have struggle.
29% of people have bad hormones.
No. Your hormones have an effect on your weight as well. So what you're saying is not true. I'm not saying that most people who can't lose weight are because of that, but I'm saying that is another factor.
But do you think it should be mandatory in the workplace, Nana? Like, do you think that's a good idea? At least it will 45 minutes exercise when you get to work. Everyone's pumped up.
I just know that the mindset of this country that would never work. It couldn't happen.
If GB News start asking me to skip on the spot whilst presenting the show, I'm not sure what that's going to go down.
We have these new jabs and pills that can make you lose weight that have been miraculous. I think the NHS should prescribe them for people that have long-term weight issues.
All right, OK.